Because I had a teacher who was a doctor of philosophy named Dr. Mankey in high school, and if I didn't call him doctor, he made me write a 2,000-word essay. Did I get your resume about correct?
You did, and thank you. I'm a professor of medicine here in Dallas, Texas, and I think at this time I've published more on the COVID-19 pandemic and certainly have taken care of more patients with COVID-19 than any media doctor you'll see on TV or certainly any agency staffer.
So have you treated more patients or seen more patients than Dr. Fauci?
Well, to my knowledge, none of the agency staffers have actually ever seen a patient with COVID-19. I think that's been one of our problems. And early on, I said, listen, these hospitalizations and deaths are terrible. We can treat everything in medicine. Let's put together a A-plus team of doctors. Let's figure out how to treat the problem and stop these hospitalizations and deaths. And that's what I did. And unfortunately, we didn't have leadership in Washington at any level that could make that type of courageous statement. They immediately started focusing on masks and vaccination. The focus has actually been on well people throughout the entire pandemic without a focus on taking care of sick patients.
No, you're absolutely. By the way, I just want to be fair. That was a leading question. The correct answer is zero. Dr. Fauci has seen zero. I can say that, but I know you're being very diplomatic about it. Look, when this started, okay, I took so much flack, including from the overlords at YouTube. And then I want to get to you have sort of a four-pronged approach, or you have sort of 4 steps that we need to address with COVID, which I think is really helpful for people out there. But I said this with my doctor on air. I said, why don't we quarantine sick people? I said, how about we just quarantine those who are vulnerable, the elderly, the immunocompromised, and we look at what treatments we have available now for other people out there to minimize the risk. You would have thought I had lobsters crawling out of my ears. I'm not a medical professional, but I don't know of any other scenario where we quarantine the healthy. So can you explain for people out there who don't know, sort of your 4-pronged approach here with COVID, what the phases are and what has not been addressed? Because the first one obviously is containing the virus, and almost all of our focus has been on lockdowns and masks until the vaccine. But explain for people who don't know.
Yeah, I testified in the U.S. Senate November 19th of last year, and I presented to America and then published this in the scientific literature. There are 4 pillars to pandemic response. First is contagion control, wearing masks and social distancing, etc. The second most important pillar is treat the problem. Treat the problem early, and we can treat COVID-19 at home. Patients can quarantine at home while they're sick, be treated. We can reduce the duration of symptoms and dramatically reduce hospitalization and death by about 85%. Because it's a fatal virus, single drugs don't work. We have to use about 4 to 6 drugs in combination, as we would in the hospital, but just do it earlier at home when they're far more effective. Hospital care certainly does provide some benefit, but the majority of patients, unfortunately, who die, indeed die in the hospital. Contemporary mortality rates for those who need the ICU at 28 days are 38%. Unacceptably high, so we need to avoid the hospital at all costs. And then the last pillar is vaccination or herd immunity. But I've always been a proponent of a balanced approach to the pandemic response. And what's frustrated America is on TV all day long, all we've heard about is masks and vaccines and nothing on treatment.
Yeah, and you know what? And I want to touch on that because it seems to me, looking at those pillars, the second one is the one that is not only not discussed, but you're almost shunned as a pariah if you discuss possible treatments for at home. And but it doesn't matter what it is. Obviously, hydroxychloroquine was very politicized, which we'll talk about. But then you have other sort of antivirals or other sort of steroids. I think remdesivir, however it's pronounced, was one of them. This is something where not only has it not really been approached as a part of the solution, people are afraid to speak about it. So when you say this is a surprise to a lot of people. When you're talking about at-home care, what does that encompass?
That encompasses now, since November, we can actually give patients an antibody infusion, a monoclonal antibody infusion that are FDA, EUA approved. And they're just as equally as approved as the vaccines, but you'll hear nothing about this on the media. And the poor patients are desperate to find these infusions, and our federal agencies have made them difficult to find. I testified in the Texas Senate on March 10th that we need to have a 1-800 hotline so patients can find out about these infusions right away. They're prepaid by the government. We just simply call a local emergency room and arrange for an infusion time. I do it every day in my practice. Sadly, 80% of these infusions sit on the shelves, not used, because the government is not focusing on treatment.
Now, why
After
is that though? What would be the motivation there? Because that's what a lot of people will ask. Well, if this can actually help that many people, it seems that you're implying something sinister. They would say, if it works, if you're not just recommending, garlic or vitamin C or just, like some other, which YouTube has banned, by the way, I want to make clear, being facetious, that's obviously not what you're recommending. Why would they not focus on treatment or at least include it at all? Doesn't make sense.
It doesn't make sense that our agencies would neglect sick people, but they have from the very beginning. And I think this is one of the obvious examples. These infusions by Regeneron and Lilly are just as high tech as the vaccines from Pfizer, Moderna, and J&J. And why our officials are not giving updates on how these infusions are going. Heck, President Trump had one of these infusions. America saw this right from the president himself. How come we've never seen updates on local TV stations, major media? It's as if this treatment doesn't exist. So I think there's a mindset among all people in the media to not bring this into focus. And our agency staffers really have to be held accountable for this. But beyond the antibody infusions, there are oral drugs that we use in combination. Early on, we can use combinations of ivermectin or hydroxychloroquine plus doxycycline or zithromycin.
Okay.
We use inhaled steroids and then oral steroids, just like we would in asthma. We can now use an effective anti-inflammatory drug called colchicine. And then very importantly, what kills patients is blood clotting. So it's important to take a full adult strength aspirin. And then for higher risk patients, we prescribe either injectable or oral blood thinners. So it takes about 4 to 6 drugs, but it's enormously successful. And finally, after our U.S. Senate hearings, even though it's completely silent in the media, we've arranged the whole country. We have 4 national telemedicine services, 15 regional telemedicine services, about 10 to 15,000 high-risk patients are treated today. And that's what's cleared out the hospitals at the end of December and January, not the vaccine.
Right.
It's been a big push for early treatment. The hospitals now have a manageable caseload. The rates of new cases, hospitalizations, and deaths are way down. The only thing that does that is early treatment.
Right. Well, here's the thing. It seems to me that most Americans think they have the option of vaccine or complete lockdown. And if they're sick, right away, get to a hospital. And that's it. These are your only options. At one point in this country, people thought we're going to have a shortage of respirators. I want to go back to hydroxychloroquine because that's something that was obviously very politicized. And the FDA prohibited doctors in one instance from using hydroxychloroquine. So some people will say, oh, no, the science shows hydroxychloroquine doesn't work, so this guy's a quack, so dismiss all of it. But really, people haven't been following up on that. There have been a lot of studies beyond the initial ones. It just hasn't been discussed in the media. You mentioned hydroxychloroquine. What does the science say about it?
Yeah, I mentioned on Laura Ingraham on the evening news on several occasions that the CDC and FDA and NIH are running about 6 to 9 months behind on the data. So now on hydroxychloroquine, I think we have over 200 studies. There's been some giant studies, 30,000 patients from Iran as an example. And hydroxychloroquine is not a miracle drug, but it's quite helpful, reduces hospitalizations and deaths by about 25 to 50%. We never use it alone. We use it in combination. Ivermectin is actually a more versatile drug that's available. And studies there show it works both inpatient and outpatient. And there's been dramatic cases where families learn about ivermectin. The hospitals and the doctors refuse to administer it in the hospital. And in fact, they have to go get court orders and force the doctors and administrators to give ivermectin, and then the patients revive and go home. So whatever's going on is not just in the agency staffers and the media, but it's in the minds of many doctors. It's what we call therapeutic nihilism. I think Americans should be worried.
Yeah, I was going to say, why can they not? In other words, if the science shows that it works, I know a lot of them. Here's one thing that I think you probably understand since you're actually seeing patients. You probably have a lot of people who come and throw their hands up, go, look, I want to trust the science, doc, right? I'm not a scientist, I'm not a doctor. And right now there's this sort of appeal to authority fallacy, which, like we pointed out, is appeal to an authority who may not be an authority, may not be a practicing doctor. But I'm sure you have people come in and say, I don't know the science. You tell me what I need to be doing right here to take care of myself. Why then, when people would hear this who aren't following the science, they go, well, if it's prohibited, that must mean scientifically it doesn't work.
I think there's a groupthink, and it's driven by a lot of fear. Remember, originally, all the major medical centers were concerned about personal protective equipment. We saw that on the media morning, noon, and night. That wasn't helping sick patients. That was trying to protect the doctors and nurses. Then when the vaccine rolled out, the first thing we heard about was vaccinating the doctors and nurses. But again, nothing for the sick patient. And so what we've learned over time is actually we've lost sight of what's going on in the pandemic. if we actually just treat the sick patient, that's where all the action is. That's how we reduce mortality. In Texas, we've now gotten, some days we get to 0 deaths per day. The only way to do that is to treat patients early. Fortunately, we're doing it. There's no credit given to the heroic doctors who are doing this across the United States.
Right.
And I'm very disappointed. The only medical society that's supporting early treatment, and they're really the hero society, is the Association of American Physicians and Surgeons, the AMA, American College of Physicians, Infectious Disease Society of America, National Institutes of Health, FDA. You know what they say? They say don't offer a milligram of treatment to patients. Let them suffer at home until they cannot breathe anymore, and then come in the hospital, and then even don't treat them. Let them get to the point where they need oxygen and then start treatment. These guidelines will go down in history as being shameful.
And you know what? One other thing, as you're speaking right now, they just said on CNN that we're about to reach 50% vaccination rate. I think they were saying 50% for the first dose, if I'm not mistaken. I can't hear you, Tokunawan, but that's all they talk about in the media here. And before we go to, behind the, for Mug Club only segment, I want to continue with you a little bit. Explain to people why you've said that can't be the only metric, and it's not even, I don't want to misinterpret you, it's not even the most important metric. Right now, it's just, can we get to that 70% vaccination rate? That's the only focus. That's all they've talked about on CNN. Is that misguided? If so, why?
It's misguided. I testified in the Texas Senate March 10th that we are already at 80% herd immunity in Texas without the vaccine. And I used standard CDC equations, and public health officials backed me up on that about 2 weeks later. Keep in mind, in the vaccine trials, less than 1% of people who get the vaccine or get placebo ever come in contact with COVID. So 50% of the nation being vaccinated is irrelevant, because vaccination will have less than a 1% public health impact.
Wow, that is, honestly, this is one of those things that you used a lot of numbers, and I'm a simpleton, so I'm going to trust you on this, but it sounds about right. Hey, really quickly, we're going to go here. This is where we would tell YouTube figuratively that they can take a hike, and then we go and discuss some things where you can get spicy. You can use foul language if you want, because we're not beholden to the big tech